It is 9 o'clock, and I want to call this meeting of the Humboldt County Board of Health to order. First item that we will do is a roll call. We'll start with the commissioners. Commissioner French, are you on?
I'm here.
Thank you. Commissioner Bell, are you on?
I'm here.
Thank you. Commissioner Cherry?
Present.
Thank you. Commissioner Brizenden?
I'm here.
The Sheriff Allen, are you on?
Good morning, I'm here.
Thank you. And Dr. Stringham?
Yes, I'm here too.
All right, thank you very much. Do we have a flag, David?
We have a flag.
All right, would you all please join me in the Pledge of Allegiance? I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. I kind of blotched the end of that. I'm sorry. Next item will be a public comment.
Commissioner Tipton?
Yes.
Oh, I'm sorry. I'll let you finish. My mistake.
Oh, go ahead. Go ahead.
Oh, I just had some public comment, but I'll let you read that.
Okay, let me finish this. General public comment is designated for discussion only. The public has the opportunity to address the commission on any matter not appearing on this agenda. However, no action may be taken on a matter raised until the matter itself has been specifically included on the agenda as an item upon which action may be taken. I know there's a lot of people with a lot of questions, so I just want to reiterate, you are allowed to make comments and ask questions, but don't expect any answers to any questions that have not been properly posted. So now we'll open it up for public comment. Paige, you had a comment?
Oh, this is Pauline Sala.
Okay, Pauline, go ahead, Pauline.
Thank you. I just wanted to let the group know that yesterday, Humboldt Connections, which is our suicide prevention group, board of directors met just to discuss some trends and gaps currently occurring in our community. We're so excited to share that we've identified our top 2 priorities within our community right now. As agencies, we're seeing an increase in the numbers of our community members presenting with anxiety, depression, and suicidal ideation. Our group is the perfect match to provide the much needed support and hope. After saying that, we all know that we're each an important piece of the puzzle, and we're calling on everyone to join us in the following activities. We're creating hope bags to provide patients diagnosed with COVID-19 who are either in the hospital receiving care or released to heal at home. These bags will contain activities to address fear, anxiety, isolation, and hope, so that individuals can feel supported during this critical time. We're looking for donations to include with our hope bag, things like adult coloring books, pencils, pens, calming activities, essential oils, word searches, Sudoku, craft projects, kindness rocks, or anything that you believe will increase hope and help our patients recover. Juvenile services will be the drop-off location for any items, and personnel will put the bags together and then get them to social worker Jennifer Slavernick at Humboldt General Hospital to distribute. If you'd like to create your own bag, feel free to and bring it to juvenile services. This is going to be a fun and exciting project and allow us to support our community members. Second, we're looking for volunteers who are trained in assist and would be willing to be placed on an all-call schedule for our community. As a volunteer, you'll be placed on rotating schedule to receive calls from individuals within our community who are at increased risk for suicidal ideation, anxiety surrounding COVID-19, and the overwhelming feeling of isolation. We believe that it's critical to provide a local response to our own community members. Please, if you're willing to participate, reach out to me or Elaine Kluwer from FCAA, or Nikki Lynn, or Nicole Maher, or Jennifer Slavernick, any of us to be put on that list. Thank you.
Pauline, this
Pauline.
is Marlene. And I have a question. The new banners that have been updated for the suicide prevention, does Jim Dandy have those on hand that if I went down and bought 3 of them, he'd be able to print them out?
I know, thank you, Marlene, for that question. We discussed that yesterday, and Elaine was going to follow up with Jim Dandy. One of the things we discussed, though, is that if we have a local call number, or some local, call numbers that we can include on that, we wanted to see if we could do that also.
So a local call number being like me? I can be a local call number, or what do you mean by a local call number?
Like the assist on-call volunteers that I just discussed, that we're creating a team of people who've been trained in the suicide prevention techniques through the assist training, that if we can get a team together and get it organized, we could include a local on-call number on those banners.
Oh,
so
I got you.
We are following up on it, and as soon as we get it, Marlene, we'll let you know too.
Okay, thank you, Pauline.
You bet.
Do we have other public comment? If we have other public comment, make sure you have your mic on.
Can you hear me?
Yes.
Hi, this is Patricia Tyndall. I'm calling from the Pleasant Senior Center, and I've had quite a few questions coming in. I just wanted to let everybody know that we are a not-for-profit agency, and our business license doesn't allow us to be open, but we are delivering Meals on Wheels. So all of our Meals on Wheels clients are getting meals every day, Monday through Friday. They're getting the frozens on the weekend as usual. If there are seniors that are COVID homebound, I guess, that didn't used to be homebound but feel they are now, they can call the office and we can add them to the homebound meal route. And people that are being released from the hospital or from Harmony Manor, they need to know that we are available and we can start them back up on their homebound meals. So that's all. Thanks.
Thank you, Patricia. Do we have any other public comment? Once again, if you have a comment to make sure your mic is working. Hearing no other public comment, we'll move to item number 4. And that is update from the public health officer, local emergency manager, public information officer on the county response to COVID-19 coronavirus. For information only. A presentation by Dr. Charles Stringham, public health officer, Captain Sean Wilkin, Humboldt County Sheriff's Office, and local emergency manager, and Nicole Maher, public information officer, regarding the current status of Humboldt County response to the COVID-19 virus, including but not limited to the latest number of positive cases in the county, as well as updates regarding the efforts to mitigate the spread of the virus. In addition, the group will update the board regarding the dissemination of information to the public through various methods. And we'll start off with you, Dr. Stringham.
Can everybody hear me?
Yes.
Excellent. Good morning, everybody. This morning, I'd like to start my comments by explaining that I think the community is doing a fantastic job with this effort, and I'm very impressed by the way everybody's pulling together, and I think there are a lot more things that are going really well, a lot more strengths than we do have areas that we need to improve. And with that being said, I do have some sad news, and I think most of the people in the community are aware that we lost a friend earlier this week, and I know we're all really feeling very sad about that. It's a small town, we're all very tightly knit, and I think that something like this hits particularly hard in our community. I'd like to take this opportunity to use this sadness to galvanize us and to make sure that that we intensify the efforts and concentrate on the areas that still need improvement at this point. And I think as long as we do that, then we can move forward and do very well with this. So what I'm seeing is essentially a bifurcation, a splitting of the efforts in the community. And much the way the rich get richer and the poor get poorer, what we're noticing is that we're starting to see people who are super engaged, but then we're also seeing people who really have an indifference. And so the efforts that we're concentrating on are primarily for those people who are not yet engaged, and that's really the biggest single effort for our group this week. One example that I just thought was absolutely fantastic of the super engaged is Jennifer Lords, is a member of the community. She'd actually graphed the data and attempted to show the performance of the curve, which I was very impressed by, and an example of a super engager. But then at the same time, we have people who are congregating in groups and not wearing masks, and so our efforts really need to be concentrated on those people. But I want to emphasize that we're seeing a lot of things that are going very, very well. The public awareness campaign, I think, has hit a saturation. I think those people who respond well to the messages, who are applying the messages, have just done a fantastic job. And I would say that I think the message that we're spreading has been received by those people who will receive messages and will engage. And so I'm feeling very, very happy about that. I think that a lot of things are going the right way. I think that there are some threats that we stand to address at this point. So the first is that a lot of people are reading on the internet that this is a fabricated crisis and that it's not truly dangerous. That a lot more people pass away as a result of cancer or car accidents. And I'd like to dispel that myth. I think that we're most concerned about the potential for growth, more so than we are concerned about the momentary numbers that we're seeing in the COVID-19 statistics. The other issue is that the reason we're not seeing the number of deaths across the United States that we had anticipated is precisely because of the things that are being done. And so when people use the relatively small numbers and compare those to influenza during certain years, I think they're missing the point. And I think one of our threats here in Humboldt County, as all across the United States, is that people need to be cognizant of the fact that the numbers are demonstrating that we are doing a good job, that our efforts are paying off. And those data should not be used as evidence to the effect that none of this was necessary. It's a very critical point. The next thing is that I want to talk a little bit about our curve, and we talk a lot about flattening the curve and slowing this virus down. It leads people to believe that everybody's going to eventually get this, and that's absolutely not the case. Our curve is a little bit different in Humboldt County, and the reason is because we're now on day 22. So 22 days ago, we experienced our first positive case. And since that time, we've had 22 cases. It's been approximately one case added per day. And in actuality, we've had a number of cases added initially rather quickly, and then the growth rate has slowed down a little bit. I would say that the curve is more or less linear at this point. We are not seeing any sort of a logarithmic curve, but I don't think it would be safe to say that we're seeing a slowdown either. So every 2 days, we're adding about 2 cases on average. Next, I'd like to brief you on kind of where we stand right now in terms of numbers, specifics, and some of the specific projects that our group is working on. So in terms of numbers, I know everybody's very concerned about the number of people who've had the virus, the number of people who are recovering, and I want to talk a little bit about that. So we've had 22 cases so far. We've a total of 7 admissions to Humboldt General Hospital. We have 1 person who's currently at Humboldt General Hospital, and as of this morning was still in critical condition and potentially looking at intubation. We have 1 person who's still in Reno who had to be transferred because that person was intubated. We have 1 person who's in Salt Lake City who was extubated, and they're now off the breathing machine and doing very well, likely to be discharged at some point in the next several days. I know a lot of people are wondering, kind of asking questions about our recovery data. And I'd like to explain a couple of different things. The first is, this is only 3 weeks into the illness here in the community. And the illness on average usually lasts about 2 weeks. And so we know that we have a total of 4 people who are confirmed to have recovered. They're better. They have absolutely no symptoms whatsoever. I know that the number is actually larger than that. And the reason is because recovery is not a specific day. It's a gradual process. And so it's very difficult to say when a person should be declared completely recovered. Also, the relatively small number when compared to 22 total cases and 4 people who we think have completely recovered, I don't want that number to be discouraging. And the reason is because this is a progressive illness. It's a very rapid illness, and it's still in its initial stages. And my anticipation is that several months from now, there will be a closeness between the number of people who have been diagnosed with this and the number of people who have recovered. The disparity right now is 18, so there's a difference of 18 in the people who have not yet recovered versus the number of people who've been diagnosed. I don't want that number to be discouraging. My anticipation is that each of these people should recover. Next, I'd like to talk about our biggest area of concern at this point. And the illness here in Humboldt County has been better represented in the Mexican-American community, and we're very concerned about that. This particular community has been hit much harder than the community in general. And we have attempted to put together a program which I think will really help us to spread the word and empower some of the people who've been most affected by this. And so the first is that we have a group that we've put together, and this group is comprised of Nicole Maher and Griselda Soto and Mike Rangel and I, and there are quite a number of other people who were involved in this. We have a multi-pronged approach, and we're looking to put a tremendous amount of resources into this effort. We really think that we can make the biggest difference by concentrating on this area. So El Sol is the Spanish-speaking newspaper here in Humboldt County, and they have very graciously run an entire page of articles about this. And they're really helping us get the word out. We appreciate our friends at El Sol. We also have the website that Nicole Maher has helped to set up, and that's called Humboldt COVID-19 Espanol. And we have quite a number of followers. I'm very happy about that also. And there'll be some new material there, but we're helping to empower the community by doing this. The other thing that Mike Rangel had come up with that I think is just a fantastic idea is Father Jose at the Catholic Church is going to be helping Mike Rangel and I tomorrow to do a public service announcement. And the 3 of us are going to team up and try to spread the word. And again, not just a public education program, but a public motivation program. So I'm very happy to have some wonderful partners working with us in the Spanish-speaking presence and education group. I want to talk a little bit about the masks, and the mask situation is very impressive. We have 1,600 masks that have been made and delivered so far by the Mucka Mask Makers group. And I think that the work of Leanne and some of the other people in the group is just absolutely fantastic. Wonderful example of the fact that we're all pulling together and doing the right things. Core Rochester Mine had donated 1,000 N95 masks to the community. Some of those have already gone to the Winnemucca Police Department and the Humboldt County Sheriff's Office, and we're going to be distributing additional masks. If there are people in the community who would like masks who don't have them, please contact me at private messaging at the website presence that we have, Stop Coronavirus in Humboldt County Now. And I'd like to talk about our community outreach program. The Humboldt County volunteer health educators also are doing an absolutely fantastic job in their efforts. We've reached out to a number of businesses, and there'll be more that are reached out to today. Planning on having kind of a group summation to figure out exactly what we're learning and what recommendations are going to be made to the various locations that we've made contact with. Very proud of the program, and I think we're seeing some good efforts. A number of different people who are involved in that. And finally, I'd like to talk about something that I was very pleasantly surprised by. Last weekend, I received a phone call from Senator Goycochea, and he was very interested in figuring out ways to reopen businesses and to figure out what our exit strategy is going to look like from the acute phase of our stay-at-home order. And there are a number of different recommendations that we're entertaining. I know this morning we're going to be hearing from a consultant who has some ideas also. I'm very excited to hear about some of those concepts. Senator Goycochea wondered if it might be a reasonable idea to open restaurants for dine-in operations and on a limited basis to reduce substantially the number of customers who'd be allowed into a building. And so we're looking at that as potentially being a test bed to see how things go. We don't know when that's going to happen. A lot of it depends on the performance of the illness in the community and what happens with the warmer weather and other unpredictable factors. And that's all I have for you this morning. I think that I'd like to emphasize the fact that there are a lot more things going very, very well in the community efforts than there are things going poorly. And I'm very proud of the efforts that are being put forth by the members of our community.
Thank you, Dr. Stringham. I appreciate that. We'll move now to Captain Sean Wilkin.
Can you hear me?
Do you have anything? Yes,
Yes.
I can, Sean.
So on the emergency management side of things, we've continued to participate in the state emergency management meetings. Warehousing through the state has gone to 3 locations. So it has for Reno, Elko, and Las Vegas. Our 5-county region is out of the Elko office. I spoke with Marianne LaFoon yesterday from Elko County. So our resource requests are going to start going through that particular warehouse. This is a benefit for our community because with the warehouses being centralized, it should allow for a more streamlined process when we make resource requests. When it comes as far as mobile hospital, that is still in place. The incident command center, the mobile incident command center is set up and fully functional. Everything is prepared and in place there. We've continued with our local emergency planning committee working groups on a bi-weekly basis. So we've been keeping our local partners and our non-governmental organizations informed as well. Seems like they're doing a really good job with following the PPE and the health guidelines with the local businesses that are still operating and that are considered to be essential. And it's good to see that they're following the advice that Dr. Stringham and other health officers through the state, health organizations are providing. And they're doing a good job trying to keep their employees from becoming infected. So that's very reassuring that we're seeing people in the community following these guidelines that are there. As of this morning, we're going to work with the hospital to request some test kits and things on a resource request to DEM. Those are currently FEMA controlled. So I'm going to reach out to the state this morning and figure out how we're going to work with them to get those FEMA controlled items here. On Dr. Stringham's comment earlier about the Spanish speaking community, on our Facebook page, there is a PSA that I posted last week. They do have a multilingual hotline that people can call into. We've been putting some Spanish PSAs out also. And I very much agree with what Dr. Stringham said there, that we do need to make sure we're reaching our whole community in that aspect. So those PSAs are there and available if people need them, if they want to call in and speak to a healthcare professional about their symptoms or health concerns related to the COVID-19 virus. That information is there and available. So as far as everything else goes, the Sheriff's Office of Division of Emergency Management is going to continue to monitor the severity of the pandemic in our local community. And we've established continuity activation protocols or triggers to address the unique nature that we have with this threat. The continuity plan will be implemented as needed, to support the continued performance of the essential functions. And that concept of operations is supported by 4 components, which consist of our programs, plans, and procedures, our risk management, our budgeting, resource management, and acquisitions, and our continuity plan operational phases and implementation. With everybody working together on this, especially through the county side, we've done a really good job of establishing these protocols as we've gone along. So these plans are in place. The resource management, the tracking in these things, the burn rates for PPE for local organizations. We're doing a really good job of tracking these things and being in a position to make these resource requests when needed. State and FEMA is really tightening down on resource requests to make sure that agencies aren't stockpiling for later. And that's a good thing for us because it means that these resource requests are going to get filled in a more timely manner as we go along. So.
Okay. Thank you, Captain Wilkin. Now we'll move to the Public Information Officer, Nicole Maher.
Good morning. Can you hear me okay?
Yes, I can. Thank you.
Okay, thank you. Hi, everyone. I just wanted to bring you up to date on some of our activities over the past week. My primary job is to support Dr. Stringham in his strategies. And so Sean just mentioned the ELCO hotline. So we are fully engaged with ELCO in a COVID-19 hotline. So we've distributed information throughout our county and are including that in both English and Spanish. And that's a wonderful resource for people to vet symptoms through a checklist process that they have, as well as questions, and they can do that phone, via text, or with an email address. As Dr. Stringham mentioned, we have a full out effort going with our local Spanish-speaking community. Just lots of wonderful things. We do have a pretty engaged Facebook presence right now. Over the past week, we've accrued just about 100 followers, and about 350 people are engaging on that page. So not everybody's a follower, but engaging on that page every day, and looking for more as this wonderful thing happens tomorrow with Father Jose and Mike Rangel and Dr. Stringham. So we're excited about that. Abel with the county continues to help translate. He does the big projects, I do the small ones, and he's been such an incredible help. And we're just trying to keep that community just flowing in the same information flow as our English-speaking community. As Pauline Sala mentioned, just looking at some of our suicide prevention efforts in light of COVID-19, and of course that goes to the health and wellness of our community as well. And so as perhaps we get this assist hotline up and running, we will include that information, that local number, in all of our information going out as well. As Dr. Stringham mentioned, one of our big efforts this week, as he said, we're just seeing a huge disparity between the mask wearers and the non-mask wearers, and we would like everybody to be a mask wearer. We would like everybody to have that kind of prevention, especially in our business settings, people who are dealing with the public. So that will be one of our pushes, and trying to get masks in the hands of the right people. And then just the last thing I wanted to bring you up on is just some of our actual outreach efforts. I have designed a postcard, and we're looking at the possibilities of sending that out county-wide. It has just an incredible amount of information on it as far as phone numbers and addresses and just reminders about those very important things like social distancing and washing hands and wearing masks. And so we're hoping to get that sent out soon. I have also spent a great deal of time this week just vetting every community in Humboldt to see who our influencers are in those communities, how we could share information that is not necessarily electronic in nature. So as I mentioned before, and you've heard me say that, not everybody's on Facebook and not everybody jumps on a computer to go to the internet, but we still want to help those people be engaged, even if they are doing the right things. we still want people to be aware of what's happening and to feel like they're a part of this presence moving forward. And so looking to get just some information, perhaps through email or actual paper information postings, things like that. And that also goes for our senior community. So Patty, just a few minutes ago with Pleasant Center, mentioned those meals going out. She's been fantastic about sharing information. And so I'm just getting ready to share kind of a template with her that we're hoping to send out to our senior population who receives those Meals on Wheels. Other than that, just trying to keep abreast of our new cases and sharing that information in a good and positive way to help people understand what that spread looks like in our community, and also just press releases and other communications on other subjects that will help people understand the kinds of initiatives that are going forward. Does anybody have any questions? Okay, thank you so much.
Thank you, Nicole. At this time, is there anybody on the health board that would like to say anything? Any information from any of the health board members?
Good morning,
Mr.
Mr. Chair. This
Yes,
Chair
go ahead,
Ballard.
Sheriff.
Okay, sorry. I just wanted to reach out to everybody. We did get a statewide request yesterday on what our crime statistics are doing during the shutdown, and just to let everybody know, it looks like our preliminary numbers are just showing that everything's on the downtrend right now. So we're not seeing an increase of crime-related calls. We also received a phone call from somebody who stated they were in isolation or quarantine, and they wanted to know if there was a placard or something that they could have to indicate, to post it on their front door, because they wanted to, if somebody came to their door, to know that they were in quarantine. And I just wanted to reach out to the board to see if this would be feasible to try to get to, if somebody who is in quarantine, if they would like to have some sort of placard on their house notifying, say, UPS or FedEx or even a friend that came over of something like that, to where they could notify somebody before they came in, or so the person wouldn't have to answer the door. So I'll just throw that out to the board for further discussion on that. On the next
Good
agenda.
idea.
Perfect.
Okay, thank you. Who else do we have here? Commissioner Cherry, do you have any comments?
I have a question for Dr. Stringham. In your update, you said that the number of positive cases is sort of plateaued. From the information that we received from Nicole and stuff, it seems like maybe even the amount of outstanding tests have declined as well. Is that the way you see it? And is that a good indication that maybe some of the safeguards that we're asking everyone to take is starting to work? I'd just like your take on that part.
I think what we're doing is really working. I think that things are going well with the public awareness campaign, and I also think that more people, the vast majority of people in Humboldt County, really are motivated and doing a great job. And what I would say is it's probably more accurate to say that the curve is linear, meaning that the ascent rate of the curve is in a straight line. It isn't accurate to say that it's plateaued. More accurate to say that it's absolutely in the process of going up. We're increasing the number of cases, but that increase is not happening parabolically in an acceleration. It's rather happening in a flat line. That line is going up. Every 2 days, approximately every 2 days, we're adding about 2 cases. So it's on average, it's been about 1 new case per day. And it'll be wonderful once we have a flat curve, meaning no additional cases are being added, because in our case, with a very small number of people in the community, relatively speaking, with respect to places like New York or other larger metropolises, our curve will likely go straight up and then probably come down very, very quickly. So not quite flat line yet, but definitely linear. Does that answer your question?
Well, somewhat, but it seems like early on we had like 20 some outstanding cases waiting for results. When I read it now, it's only 5 or 6 or so. So that either tells me that we're either getting results back quicker or less people are getting tested.
I think that's what it is. I think we're getting results back faster. In the early days, we were taking between 4 and 5 days to get test results back. And now average seems to be between 1 and 2 days.
Okay, thank you.
Mr. Chairman.
Thank you. Commissioner French.
Thank you, Mr. Chairman. Can everybody hear me?
Yes.
I think I'm unmuted. Along that same line for Dr. Stringham, I was wondering, I've had some questions that have been leveled at me in the last week. One of them having to do with the testing side of it. Obviously, there's a lot of buzz about the point of service tests that are actually being that have been recently authorized through FDA, and I'm wondering. I don't know if Dr. Stringham just talked about an Abbott test machine that was just delivered yesterday, but are the protocols for testing point of service testing in place right now, and are we going to be testing a lot more people down the road here? And then the second part of my question is there protocols for testing outside of people that are presenting with COVID symptoms at the West Campus?
Yes, kind of a complicated answer, but the first thing I can tell you is that it's true. We just did get a new machine. It's a point of service test, and it's made by Abbott. The state has distributed 16 of those apparatuses, and Humboldt County was chosen to get one. And it's a wonderful addition to our testing capacities, theoretically, because the problem is that we only received 8 test cartridges. So this gives us the capacity to use this machine only 8 times before having to be replenished. 8 individual patients can be tested. And so the good news, we have the capacity to test within about 5 minutes, get very, very fast test results. They're accurate. And it's the state has provided this free of charge. So there are a lot of really good things about this. And theoretically, this could be a real game changer, but it isn't going to be early in the process because we're limited in the number of tests, the reagents that we're able to get for this. We've been told that the testing supplies are on back order, and nobody seems to know exactly how long it'll take to get additional tests. So that's the first issue. And the second issue is that the testing strategy, I think one of the reasons this question is on the minds of so many is because it's one of those areas where what we would think is different from what's actually happening. And so the preconceived notions that people have of best strategies to test and to kind of determine who has this condition, what we would think makes sense isn't really what's happening. In other conditions, we test, we find the disorder, we can identify folks, stratify them, and come up with treatment plans on a large scale basis. And that's the case with almost anything else I've ever been involved in during my time as a doctor. Problem with this, though, is that we were already playing catch up in the early phases of the COVID-19 outbreak, and we haven't really caught up yet. And so even though we have a number of different capacities to test, and FDA has approved quite a number of different tests, Henry Schein makes one. It's also a point of contact test. Abbott makes one. State laboratories are having faster turnaround at this point. There's just a lot of really good things happening, but it's all theoretical because still the total number of tests that we have is very small. And so I think that for the foreseeable future, our strategy in determining who has this and determining who we should stay away from is largely going to stay the same. It will be universal precautions rather than identifying people and isolating those people. It's kind of a frustrating strategy, but at the same time, it's what we have now. My anticipation is that'll change at some point in the near future as the number of tests become more readily available.
Okay, thank you.
Thank you.
Commissioner Bell?
I have no questions at this time.
All right, thank you. Commissioner Brizendine?
Dr. Stringham, I have actually a concern when you said that you heard from Senator Goycochea and he'd like the restaurants to be opening sooner than maybe they could be the first to open up. Do you feel that wide approach of testing needs to be done before that occurs, or what is your feeling on that?
You know, I think that we're fighting a campaign on many different avenues. There's so many different areas in which we could potentially wind up running into trouble. One of my primary concerns is that as we transition between the acute phase of this effort to the chronic phase, I think the biggest threat is going to be a loss of public support as people continue to have more and more economic constraints and more information to the effect that that this wasn't really necessary, and a lot of different misinformation that's already being spread. I think public support is going to be the most important thing for us to continue to have a good handle on, have good good engagement from everybody, and to continue that engagement. In order to do that, I think that we're likely at some point, I don't think that time is now, but we're likely at some point going to need to show that we're slowly reopening businesses and getting back to life as usual. I think right now we're still in the phase where this is very dangerous and the number of cases that we have are growing. And so I do not think, and I don't think that Senator Goycochea thought either, that this was an appropriate time to take these actions. We were just looking at eventually, when that time came, what our strategy would look like. We talked about kind of a switch effect where you just turn things on in one sweep, and I don't think anybody supports that. I think that most of us kind of support a slow advancement of a throttle where we gradually add various businesses to the open business list. And to me, it just made most sense to start with restaurants. There likely are other businesses that would have these same attributes too. But by virtue of what restaurants do, they bring relatively small numbers of people into an establishment in a controlled environment where health codes are already well present and adhered to. They're people who generally have experience with health codes and various other constraints. And so it just seemed to make sense that that would be a good test bed. And so I'm not saying that there aren't other businesses that would also fall into that category, but for example, beauty salons and various other establishments along those lines were also considered. But by virtue of the close contact that occurs in those types of settings, we didn't think that that would be a good initial test bed. And the reason I mention that is just to give you kind of a taste of the spirit in which the conversation was intended and what types of things were considered for candidate businesses that might be among the first to open.
Okay, thank you.
Okay.
All right, thank you, Commissioner Brizendine. From that point, we'll move to item 5, and I think we've already pretty much handled that, but we will go through that anyway. Preliminary discussion regarding safely opening the economy. It says for possible action, consideration, discussion, and possible action regarding scenarios to safely open the local economy sometime in the near future. Now this, per statute, this item will only be discussed. No action will be taken today. And I think Dr. Stringham already covered that. I too had a conversation with Senator Goycochea, and our conversation was just trying to get out in front of this and be a leader when that time comes and know what our strategies would be, know where we're going with it. That's something the county commission will be probably taking up in the future. It is not on our agenda for our Monday meeting, but that's what we're trying to do. And Senator Gokachia is kind of leading that effort on a state level. So is there any other comments or discussion on possible opening of businesses and looking at the scenarios?
This is Commissioner Cherry. I too had a conversation with Senator Gogachia, and I've also talked to some of the businesses in town that are non-essential, particularly the restaurant businesses, and asked them, how they're dealing with this. And like we all know, we're less than a month into this, and most of these businesses had enough revenues, from savings that they have been able to maintain. But as we get into 2-3 months on this, they're going to have to make some really difficult decisions. No one can go without revenues for 2 or 3 months and expect that when things do open up, it's not going to be business as usual. They've already started thinking. They know that they're going to have to make some changes in the way they operate. Maybe you used to have 100 clients in your restaurant. Maybe now you're going to be looking at 50, and they're thinking about that. But even if it's half as many as they would normally have had before this, they think that they can survive for a little longer if that can happen. The deeper we get into this, the harder and the longer these non-essential businesses stay closed. I just lost everybody's picture, but the harder it's going to be to bounce back as well. So I'm wondering, and Chairman Tipton, you mentioned this, that we need to probably as the county commission look at what non-essential businesses would make sense when things start leveling out here of opening again. And maybe there needs to be a team that would evaluate these businesses and make sure that they have proper safeguards, not only for clients, but for their employees and stuff, and help them develop some criteria. So when things do open up again, they can at least start operating at a minimal level. So that's just my comment.
Thank you. Commissioner French.
Thank you, Mr. Chairman. I think, and I have to echo the same things that Commissioner Cherry just said, having to do with these businesses. And I think, just in my own mind, that one of the game changers that's on the horizon right now that we really need to hold out there and really prioritize for our community is in the area of rapid testing. I think with regard to those people that have closer contact in their business with patients, with customers and such as barbers and hair dressers and such, would be if those folks could be tested to where they could demonstrate that they are not a coronavirus infected. It would allow them to at least be able to operate with a group of people, at least with the assurity that they're not going to be infecting their customers and such. And I see as going to be opening these businesses going to be kind of a marriage between the testing side of it to identify those folks that we may need to take a look at down the road versus those people who have either had this disease and have gotten over it or are not infected. And I think that is, that whole notion that that the entire population is quarantined as such versus those folks that we can demonstrate that actually have been infected or are at risk of infection. I'd like to see us be able to move forward with a an item on our agenda I don't know how we go about requesting the reagents for the testing equipment that has been recently been brought to our community. But it seems to me that's a key, and I realize everybody is competing for the same thing, but I think from our standpoint, we're the second, per capita, we're the second only to Clark County in terms of infection rate per 1,000 people. So I think that is something that I think puts us in a position of asking for at least a higher place on the priority list. With that, I'll leave it there. Thank you.
All right, thank you, Commissioner Prince. Commissioner Bell?
Yeah, I would actually echo what Commissioner French was talking about, and I think what is absolutely key to opening the economies from everything that I've read and studied on is rapid testing, and I think we need to pursue that very vigorously to get our economy back up and running. So that's about all I had.
Okay, thank you, Commissioner Bell. Commissioner President. I will come back to you. Dr. Stringham, do you have any other thoughts on this?
Yes, I do. I think that I'm really happy that everybody's very concerned about the economy and the welfare of the people in Humboldt County. And I think that everybody's made very momentous sacrifices in order to be able to deal with this. And I think we all realize that this has been really difficult for people. And so I think that primarily for the constituency, I want everybody to know that I think all of us are taking this very seriously, and all of us really are giving priority to the economic welfare and various other abilities to get back into the game for the community every bit as much as we are for the healthcare aspects and other things. I think we're all acutely aware of that. I also want to point out that I think in the future things are going to look very different. We're going to receive a number of really good tailwinds in this fight. The first is the warmer weather is likely going to help us. The second is the availability of testing is going to get better. The third is that the number of absolute cases that we're seeing is going to drop. So the number of people out there who have this condition who can transmit it will be much smaller also. The other thing is that the vaccinations are likely going to happen faster than had originally been said in the initial phases of this. And so I hold out hope that a lot of things are going to get much, much better for us very quickly. One other thing, I'm sorry, the other thing been mentioned, the ordering of tests. I know that the hospital has absolutely done that. Before we even received the machine, there were orders that were made for new test reagents, and it's true they're on back order, but it's also true that they may be here fairly quickly. So I still think that this is a good thing, and I think in the end we'll be able to get new reagents to do new tests very quickly.
All right, thank you. Sheriff Allen, do you have anything else that you'd like to add to this item?
I just want to echo everybody else's comments. I do believe that we need to get the economy going as quick as we can, as long as we're making sure we do social distancing and be as safe as we can so we don't endanger others. Thank you.
And Mr. Chairman,
yes,
this is Marlene. And I agree with everybody that, yes, we need to get our economy going, and taking a proactive stance on it and figuring out how are we going to do it most effectively. And like Dr. Stringham said, the most foolproof situation is a vaccine. And but we need to get it going sooner than later, because we need to get our local economy going.
Thank you, Commissioner Brisden. Yeah, just remember, I would ask everybody on here to tell their friends, if you see friends or family that aren't taking this seriously, explain to them that they need to, and if they would all assume that they may have it and wear a mask and do all the things that's been asked of us. And number two, assume that their friends, family, and people they're around may have it, So you don't want to get up from them and ask them to wear a mask and do those things. So I think we'll be out of this relatively soon if we all do those things, and we can move forward as in the next month here and look at how we're going to open businesses up and work with our governor and the federal agencies as well. At this time, are there any future agenda items that anyone wants put on for our next meeting?
Mr. Chair, this is Dave Mendiola.
Yes.
So far I've got two that I've made note of. The question from Sheriff Allen regarding a placard for COVID-19 isolationists, if you will. So I'll bring something back on that. And then options for testing to create safeguards or the rapid testing. I'll have some kind of language with respect to that. And then also, we'll kind of tweak this language for this opening of the economy issue to just make sure that, the fact is this board nor the county commissioners have the authority to open up. That's really either the governor or the president to do that. That's still being argumented about. But in any case, what I do believe, and just to make a comment as a citizen, is we have to start talking, as we've already heard today, with those non-essentials now to tell them, start thinking about the protocols, the mitigation protocols that you would put in place if you did get the go ahead. And what kinds of things would you do? And we have done that with the volunteer educator group for essential businesses. And I think that may be our phase 2, Dr. Stringham, is to have them start calling non-essentials, or at least a representation of those, 2 or 3 hairdressers and different businesses that have been deemed non-essential, and start talking to them about, if you got the go ahead today, how would you do it? Because I think the whole key to this thing is we have to encourage citizens who are, our consumers. We have to get them convinced that it's a good thing to go out and I can do this safely. And if those people are putting safeguards in place that reduce the likelihood of that happening by, 95 to 99%, that's safer than we normally work anyway, just in my personal opinion. So I think it's a good discussion to have. And if we're prepared for that day, we're going to get a jump on everybody else to get this thing moving, and it'll come up to speed a lot quicker, I think.
Thank you, David. Future meeting dates and locations. Location will be teleconference. I would suggest that we have it again next Thursday at 9 o'clock. Do I have any questions or opinions on that?
Nope, that's the 23rd, right, at 9 a.m.?
That's good.
Okay. So we'll set our next meeting for April 23rd at 9 a.m. Is there any other public comment at this time?
Commissioner, this is Kevin, Sheriff's Office.
This is Kevin. Okay.
Okay. Who is from the sheriff's office there?
It's Captain Woken.
Okay, Captain Wilson, go ahead and go.
I'd like to ask on the Spanish-speaking working group. I do have Spanish-speaking deputies both in detention on patrol at the sheriff's office. We do have a large Spanish-speaking population, especially in the agricultural ranching communities here in the unincorporated county that are not reached by social media and internet. So since that working group is established, I would like to have somebody from the sheriff's office included in on that. It is important to us that we reach our whole community. And some of the folks that are in the outlying areas, one of the best sources of communication is going to be through the county.
Thank you, Captain.
This is Karen Cole, Ken, Commissioner
Okay,
Tipton.
Karen. Yes, Karen, go ahead.
Thank you very much. There were just two things that I wanted to address today. I appreciate the discussion relative to the rapid testing. I just want to echo what Dr. Stringham has said, and we've worked really closely with Dr. Stringham, just actually on a number of things. He attends regular meetings at the hospital with us, of course, virtually, as we all are. But we have had great effort to try to get the reagents needed, the test kits needed for the rapid testing. And so we will continue to do that. I promise you that we are making our best efforts with that. And we'll continue to work with the county and the state because we may be more successful if we do that through the public entities then rather than not. So I just want you to know our efforts are absolutely there. The other item that I wanted to mention was telemedicine or telehealth visits. We have worked over the last couple of weeks to be able to bring that to our patients. And so we are calling patients now who would normally have visits with their providers to give them the option. There are some patients where a telehealth visit would be very appropriate. Obviously, you cannot do that with every single visit, but for those visits that are appropriate, we are set up to do that now, and we are calling our patients. And it's for two reasons. The primary reason is so that our patients with chronic illnesses are not just left in the lurch at home without appropriate care that they need. And of course, you know, the whole economics that everyone's talked about for all the businesses, that certainly it's a reality for the hospital too. So I just wanted to share with you those two items this morning. Thank you very much.
Thank you, Karen. I appreciate those comments.
Mr. Chairman.
Any other public? Yes.
Mr. Chairman, this is Commissioner French. And with Karen's comments, I wanted to touch bases again on this item of the testing. And I certainly didn't mean my comments to be as criticism for anybody. I realize everybody's hitting on all 8 cylinders trying to get this done. And my comments are more on the line of looking for opportunities for this board and maybe the county commission to possibly grease the skids for the community to, if possible, for those to be placed higher on that priority list for these tests, reagents right now. And that's really the direction I'd like to take that, is that if we can be have a role in that, I'm certainly all over that. Thank you.
Thank you, Commissioner French. Do we have any other public comment?
This is Monica Still with Nevada Gold Mines.
Thank you, Monica. Go ahead.
I just wanted to check with the board to see if there is any kind of support from Nevada Gold Mines that we can assist with at this point in time.
Dr. Stringham, is there anything that you would like from Nevada Gold Mines?
You know, Monica, thank you so much for the offer. That is so kind. We've had wonderful support from you folks, and we really appreciate that very much. I know that you and I will be talking a little bit later this morning, and maybe we can talk about that at that time. I really I want you to know that I really appreciate. I know everybody else on the board does too. The support that Nevada Gold Mines gives us. It's very, very kind. Thank you.
Thank you so much.
Thank you, Monica. Do we have any other public comment?
Commissioner Tipton?
Yes.
Commissioner Tipton, Tom Haas?
Yes, Tom, go ahead.
We've gone over in this meeting, and I appreciate all the efforts with everybody involved. There was talk about the non-essentials being the barbers and the hair salons. There was some information yesterday on the internet that I haven't been able to verify yet, and I would appreciate it if you guys would try. That non-essentials, there was hairdressers brought in to give the haircuts to the police officers and firemen down in Las Vegas by the governor. And we might check with the governor to find out what they used as precautions so that this could be done, which would help you make some anyway, to bring in the non-essentials quicker than not, and just find out what the information you can on what they use for precautions. Thank you.
Thank you, Tom. Do we have any other public comments? Any other public comments? Hearing none, I will adjourn this meeting at 10:05 a.m. Thank you, everyone.
Thank you.
Thank you.